Hello, everyone. Welcome back to St. Louis Teens. We are here again with Dr. Zinser, who is the head of infectious diseases at SSM DePaul Health Center. 9 months into this pandemic has been a rough time for all of us, and we are thankful for your efforts and the efforts of all physicians, researchers, and immunologists working to end this pandemic. Dr. Zinser, thank you for being here with us today to answer some of the concerns of our viewers about the COVID-19 vaccine.
Sure.
Dr. Zinser, since the COVID-19 vaccine came out this fast and is approved on an emergency basis, one of the biggest concerns is how safe is it?
It appears to be as safe as all the other vaccines that we take. And people raised theoretical concerns about it, but the people who understand how it's put together say that there are not concerns about long-term immunologic side effects. And this is really a new technology that appears to be a very clean technology. At this point, an awful lot of people have gotten the vaccine, and it's behaved just as other vaccines with occasional reactions to a vaccination, but no more than other vaccines.
And I think that brings up the question of, are there any groups of people that must be careful or avoid this vaccine, whether that be in terms of people who are very sick or for other reasons, perhaps those with cancer on chemotherapy or something else?
It's not a risk to people on cancer or on chemotherapy. The only people who may be at some risk are people with autoimmune diseases that either aren't well controlled or have very serious manifestations. And so people with autoimmune diseases that have those kinds of problems see a rheumatologist, and they should talk to their rheumatologist. But by and large, everyone should get this vaccine.
And you talk about everyone needing to be vaccinated. What are the benefits and advantages to this?
So the benefits are that you'll avoid getting sick with COVID, and you'll avoid spreading it to others. Asymptomatic carriers spread it. If they're vaccinated, that's less likely to happen. So the problems with this disease are that it can cause long-term complications for people, that it can cause long-term lung complications, and it also can cause autoimmune diseases. And that's a very serious problem. Avoiding those issues is very important. And it's very important to reduce the chances that you're going to transmit it to someone who transmits it to someone who is older, perhaps in your family, who could die from it. And one of the unfortunate facts about this pandemic is that there are a lot of people who died from it. But you don't see those people because in our society, we don't deal directly with death very much. We don't see people in our community preparing the body and preparing the casket, and everything is so far removed from us that it's almost as if it doesn't exist. But unfortunately, it really exists for real people.
And Dr. Zinser, if someone has had the COVID-19 infection, do they need the vaccine?
At this point, we're giving it to people who've had the infection. We wait for 90 days after the infection so that they're not still having their initial immune response, which could blunt the effect of the vaccine. The we don't know um, the durability of immunity, either with natural infection or with the vaccine. It's probably more durable than we're preparing for, but we don't know that yet.
And are there any side effects that one needs to be aware of with this vaccine when they are getting it?
So, in general, excuse me, the first vaccine is tolerated well. Uh, the if you've had the infection before, you might have more of an immune response to the vaccine, which can make you feel like you have the flu for a day or two. With the second injection, people do tend to feel like they have the flu for a couple of days. And that simply means that the vaccine is working and doing what it's supposed to do, which is create an immune response.
And if someone is uninsured, how much will the vaccine cost them?
At this point, everybody should get the vaccine for free.
And how long after the vaccination will one develop the immunity, and how long does that immunity last?
People will develop immunity within 6 weeks of the first vaccination, which is 3 weeks after the second vaccination.
And another common question that comes up is, should we be wearing masks and social distancing even after we receive the vaccine?
We should continue to wear masks and social distance. Uh, One thing that has been a benefit of this pandemic is because people are wearing masks, even though it's not universal, but because enough people are wearing them, we haven't had influenza this year, and we haven't had the other respiratory viruses that we normally get. If we quit wearing masks, those will start to pop up and to spread. And that, in combination with the COVID pandemic, can be very dangerous for people.
And I think a topic that has been brought up a little bit is, what are the prospects for a vaccine for children under the age of 18?
I expect that they will be coming out with recommendations for that. It may be a few months. They're just actually doing those trials now, but there's no reason to suspect that this is different than any other vaccine, and that people of all ages will benefit from it.
Dr. Zinser, thank you so much for educating us and helping us fight this pandemic more efficiently. And thank you so much for being here with us today and answering all of our questions.
Thank you very much.